In his 2016-17 budget, Financial Secretary John Tsang noted that the government has devoted substantial resources to improving people's livelihood. Mr. Tsang said the government will inject nearly $200 billion into social welfare, healthcare services and education, adding that these will be the three main areas of expenditure over the next financial year. Government expenditure on education a decade ago was $45 billion, which has increased to $75 billion in 2016-17, a 67% jump. Social welfare spending is also on the rise, from $32 billion to $66 billion, an increase of more than 100%. While spending on healthcare services has increased by 90%, from $30 billion to $57 billion compared with a decade ago. Mr. Tsang noted that the estimated recurrent expenditure on these three areas for 2016-17 is $198 billion, accounting for 60% of recurrent government expenditure, representing an 80% increase from 10 years ago. To cope with an ageing population, the government has set aside $200 billion for a 10-year hospital development plan for the Hospital Authority to expand and upgrade healthcare facilities in a more flexible and long-term manner. The plan will provide 5,000 additional hospital beds, representing an increase of 18%. Operating theatres will also increase by 40% to 320, while specialist outpatient service capacity will increase by 40% from 6.8 million to 10 million attendances a year. The government will allocate $10 billion to the Hospital Authority to set up an endowment fund to generate investment returns for enhancing public-private partnership programs, and will also provide a $4 billion loan to the Chinese University of Hong Kong for developing a non-profit-making private hospital. A recurrent provision of $2.9 billion will be allocated to implement the Low-Income Working Family Allowance Scheme this year, which is aimed at alleviating intergenerational poverty by encouraging employment and helping poor families with children. To help women manage family commitments alongside work, the government will provide an additional 3,800 extended hours service childcare centre places.